114,000 men, women, and children await a life-saving organ transplant. I never considered organ donation until someone that I loved needed a liver. I have heard things all my life about organ donations and how they save lives, but I never considered being one, and honestly, I half-hearted listened to what was being said. In 2010, I met a 7-year-old girl named Kennedy that was in dire need of a liver. She was born with a rare disease, biliary atresia, that affected her liver, which would lead to kidney disease if not corrected. She underwent surgery when she was born, but that only helped for a short time. Her ultimate cure was a liver transplant. I want to talk to you about the types of donations, the need for donation, the process to become an organ donor, and the importance of being an organ donor. There are 2 types of organ donations, living and deceased. Living donations is an opportunity to save a life while you're still living. Living donations are not covered by your donor registration and must be considered personally and discussed directly with the transplant center. Living donations offer an alternative for individuals awaiting transplantation from a deceased donor and increase the existing organ supply, which is saving more lives. For a person to become a deceased organ donor, blood and oxygen must flow through the organs until time of recovery to ensure viability. After all efforts to save a patient's life have been exhausted, tests will then be performed to confirm the absence of brain or brainstem activity and brain death has been declared is only a possibility for donation. The National Donate Life registries are searched securely online to determine if the patient has personally authorized donation. Now let's talk about the need for organ donations. According to donatelife.net, there are currently 114,927 patients waiting on the transplant list in the United States. There are various donations, so that means there are different wait times for all, which are very lengthy. Average wait for organs include 185 days for a lung transplant, 679 days for a kidney transplant, 239 days for a liver transplant, 281 days for a pancreas, and 181 days for intestines. On a daily average, 20 people die from the lack of organs. In 2017, more than 1,800 children received life-saving transplants, matched from nearly 900 pediatric donors. Currently, there are 2,000 children on the National Transplant Waiting List. More than 500 children waiting for a donor are ages 1 to 5 years old. Some conditions for pediatric transplants can include congenital heart disease and cardiomyopathy needing a heart transplant. Kidney transplants can be caused from acute kidney failure and chronic kidney disease. Liver transplants can be needed from Wilson's disease, glycogen storage disease, acute and chronic hepatitis, obstructive biliary tract liver disease, cirrhosis, along with many other diseases. Causes for lung transplants can be cystic fibrosis and pulmonary hypertension. Next, let's discuss how to become an organ donor. Registering to be a live donor is easy. It takes less than a minute. All you have to do is go to donatelife.net and click the Register to Donate button. To be an organ donor once deceased, you need to register at the Department of Motor Vehicles. There are several important reasons that everyone should consider being an organ donor. AmericanTransplantFoundation.org states one deceased donor can save up to 8 lives through organ donation. This is because organs that can be donated after death are heart, liver, kidneys, lung, pancreas, and small intestines. Tissues can include corneas, skin, veins, heart valves, tendons, ligaments, and bones. So many lives can be saved, and many lives can add to quality if you would be a donor. A healthy person can become a living donor by donating a kidney or part of a liver, lung, intestine, blood, or bone marrow. About 6,000 living donations occur every year. 1 in 4 donors are not biologically related to the recipient. In summary, there have been many lives saved due to transplants and donations. However, there can be many more if people were more aware of the outcomes. We have seen just a few numbers and types of donations. Kennedy received her transplant on February the 14th, 2018 at the age of 15. Because of someone that registered with their local DMV, Kennedy is now living the normal life of a 16-year-old girl. I waited until I was in my 20s to decide to learn the importance of being an organ donor and registering on the National Registry. I hope that after hearing the statistics and seeing the outcome of one blessed teenager that you too will make the decision to register and save a life.